Having an ultrasound scan is an exciting stage of a pregnancy. We hope that this video will provide you with some valuable information about what to expect during an anomaly scan appointment. The anomaly scan is usually performed around 20 weeks of pregnancy. By this stage, the baby is well developed and is a good size to perform all the checks that are part of the anomaly scan. The person who does the scan is called a sonographer. Sonographers are trained to a high level to perform the scan safely, and they hold a postgraduate qualification in medical ultrasound. The scan is similar to the earlier booking scan, but provides more detail of the baby. The anomaly scan is also sometimes called a screening test. During the scan, certain conditions can be looked for or screened for. Screening tests don't harm the baby, but can lead to a difficult and unavoidable upset if a problem is detected or suspected. This is partly because screening tests are not perfect. Sometimes it may be suspected that a baby has a problem when it doesn't, and sometimes the opposite occurs, as not all problems can be picked up with screening tests. Like any test in pregnancy, it is the mother's choice to agree to have it or not. The sonographer will ask for the mother's consent before the scan begins, so it's best to decide whether or not the test is for you before you attend. Doing all the checks of baby's anatomy will take up most of the scan time. The anatomy that will be checked includes the heart, the head, the abdomen, the bladder, the kidneys, the long bones, the face and the spine. The heart usually takes the longest time to check as it needs to be looked at from a few different directions. Please don't worry if the sonographer is quiet or seems to be taking a long time, as they need time to concentrate on this complex organ. As well as looking for certain conditions during the scan, the sonographer will also look at baby's growth, baby's environment and the placenta. Measurements will be taken to include baby's head, waist and leg bone. We will get better pictures if mum comes with a comfortably full bladder. We may have to apply slight pressure during the scan to get the best views. This may be slightly uncomfortable, but it does not harm the baby. The ultrasound view of the baby can be made worse if mum's body mass index is increased, if fibroids or abdominal scarring are present, or if the baby is in a bad position at the time of the scan. The scan itself takes around 25 minutes to do. The whole scan appointment will last 30 minutes. The scan requires intense concentration by the sonographer, and sensitive information may be given during the scan. Please assist the sonographer by not bringing children to the scan, as this may cause a distraction for both the sonographer and yourself. We want you to have the best experience possible during the scan. Photos can be printed for you on thermal paper during the scan. Please let the sonographer know if you would like a photo at the time of the scan. You can give a donation for photos if you wish. At the end, the results will be given to you verbally, and a copy of the report will be placed in the green maternity handheld notes. So it is important that the maternity notes are brought along to the scan appointment. The report will include the measurements taken and a list of checks that have been made. In about 9% of babies, we are unable to complete the scan in one go. This is sometimes because of the way baby is lying, the image quality at the time of the scan, or sometimes it is due to other factors. Please do not be alarmed if we cannot complete the scan. If we do have to get you to come back at another time, we like to perform the rescan before the 23rd week of pregnancy whenever possible. We are normally able to complete the scan on the second rescan appointment. If all appears to be progressing normally, the antenatal care will continue as normal. In some pregnancies, the placenta may appear to be low-lying at the time of the anomaly scan. This will mean another scan will be recommended to be performed at around 32 weeks of pregnancy to make sure the placenta is not covering the neck of the womb. In a small percentage of pregnancies, an abnormality may be detected or suspected during the anomaly scan. Sometimes in these cases, the sonographer may ask another member of staff for their opinion. This second opinion is also sometimes carried out when the sonographer is struggling to get some of the views of the baby that are required. As human beings, we are all different inside, so sometimes we see differences in some babies which aren't abnormalities but are just a variant from the norm. If there are any concerns, the sonographer would tell you and would make a referral to a specialist doctor. Although it is not part of the scan checklist, if asked, the sonographer will try to see the baby's gender if you would like to find out. The accuracy is not 100%, and sometimes the baby will be lying in a position which will not allow us to see. This information about the gender will be given to you verbally. As this is a medical examination, it is not possible for you to record the scan yourself in any way. Parking can be very difficult at times, so please allow 40 minutes to park. If you are able to, please use public transport available. Unfortunately, we will not be able to perform the scan if you miss your appointment time. Please do not hesitate to ask the sonographer any questions at the Anomaly scan appointment. We hope you have found this information helpful, and we hope that you have a pleasant experience during your Anomaly scan appointment.